So when you're palpating the lumbar spine, you want to check out a few areas. You also want to look at some of the forces that are going through the lumbar spine. We already checked the compression force. Now we want to check out the shearing force and the torque. You can start with just general palpation, starting at the lumbosacral junction and working up. You can also palpate the long dorsal ligament around the SI joint. As we said, the Fortin's finger test says that most of the time, if the patient points right here, then that's a sacral problem. According to Lee, it's the long dorsal ligament that is irritated, and you can palpate and check to see if that is in fact the case. You can also palpate up the lumbar spine, checking the interspinous ligaments and seeing if there's any increased pain. You can also check the iliolumbar ligament, which you can palpate the horizontal band as it comes from the iliac crest over to L5, seeing if there's any areas that are painful along the iliolumbar ligament on both sides. To check the forces going through the lumbar spine, you can do PA pressures as you work your way up. Slow sustained pressures, or you can add quicker vibrations to see if there's any area that feels stiff or feels like it's too mobile. And you can check those out with some of your other testing as well. One of the best tests that you can do is called the torque test. With the torque test, as I showed you on the model, you put your hand near the thoracolumbar junction, get under the ASIS, and be careful, this is sensitive, just because it's bony, and you lift, and you look to see if there's a reproduction of pain as you're compressing the one side and distracting the other side. When you do the torque test, you have to walk around to the other side of the bed to check the other side as you lift. If the patient has a positive pain response, then what you'll do is you might want to localize your force to a specific area when you're doing the torque test. Most times it's around L5, S1. So that's checking out torque and shearing and some of the different ligaments that are around the lumbar spine that are sensitive during a motor vehicle accident.